Our three different perspectives would all have different views of the issue. Functionalists would see the importance of wellness for all members of society. However, the functionalist perspective would view the individual providing for their own health care as part of the well-functioning social world. Functionalists would believe that the current medical model might be replaced with a different model, but that this will occur naturally when the needs of society dictate that social change should occur. Conflict theorists would focus on the issue of race, income, and locality as driving one's access to health care. It would see the inequity in the system and that some people have much better health care than others. Conflict theorists would emphasize the need for the system to change in order for all people to be able to access adequate health care. Critical race theorists would understand that people must have access to adequate health care in order for all people to be free and healthy and have a thriving social order. There would be a strong emphasis on racial ecology and the need for all people to live in healthy and non-toxic environments. It would also emphasize the ways in which policies must change in order to assure this. Critical race theorists would see that in the U.S., healthcare is a privilege that the upper classes have the ability to access, while the middle class struggles to afford it, and the lower classes have marginal access, if at all. The U.S. ranks very low in the industrialized world in healthcare. It ranks 30th in life expectancy. The U.S. ranks 44th in healthcare efficiency. In order to improve U.S. healthcare, the government needs to address the causes of healthcare disparity. A major issue for the U.S. is the high cost of healthcare, the cost of regulations, the cost of the laws, and the for-profit healthcare system. In order to improve healthcare, policymakers must also work to reduce poverty, increase income and job security, increase education, and improve access to healthcare. And that concludes our chapter on inequality in health. In our next section, we're going to be looking at how our laws impact different groups of people.